Not only has the MonWHO staff been completely ignoring our requests for food, they are also seemingly trying to fucking suffocate us.
The plenary session was hotter than Africa, and that's coming from the South African Broadcasting Corporation.
We are the media and we are disappointed.
Nay, we are appalled at the lack of communication we have been able to have with our audience.
Is there or is there not a bias on the dais?
We have a few demands. We want the dais to represent our tweets and make them legible.
They need to be seen at all times by all delegates so that we, the media, can communicate information to our audience, the delegates.
We need to be heard.
Thanks to declining revenues and technological changes, media organizations are stretched thin. 3 key players across 3 continents saw an opportunity in scale and merged. We are SABC, BBC, CNN. We are the media. Our remaining reporters will finally be able to eat their lunch in peace among seas of empty cubicles. We have programmed their new mantra: do more with less. We are the media. Resisting buyouts is futile. You will be conglomeratized.
This is Johannes Finkelheimer, here to congratulate all of you on a job well done. Don't let your fatigued and overworked liver affect your delivery of draft resolutions. But perhaps you should make a resolution to stop drinking so much draft. But I digress. Here at MonWHO News, we are glad to see that truth, justice, and the little people who depend on you have all been served by your exemplary efforts to break apart these vexing global health problems. But please, everyone, speak your mind. There is only a few hours left, and just because these are non-communicable diseases doesn't mean that you can't be communicable about them. What's that, Latvia? Or should I say, Loudvia? Your Baltic neighbors are reporting a sudden epidemic of hearing loss. Europe is a big place, and everyone deserves a chance to be heard. These diseases may not be communicable, but your voice clearly is. The volume of the discourse has been tremendous, but the substance of contributions, not so stupendous. Be bold, intrepid healers. Use your nation's might to crush generalized measures under the boot of poignant and specific and constructive ideas that are sure to serve the public. We here at MonWHO News are pleased to see so many of you getting your voices heard by the reporters. Let's check in with the first plenary's highlights.
Our first point is that we urge all member states to increase access to primary care. We believe that primary care is one of the biggest solutions to helping with NCD.
Our second main priority is to emphasize the tackling of social disparities and income inequality in all our countries and being able to nip the root of the causes of NCDs.
By tackling social disparity and having access to quality primary care, we think that we should be able to really improve the state of non-communicable diseases.
And we have
I think like 7 or around 7 signatories, including Chile, Panama, Barbados, Jamaica, a lot of broad support across different groups.
Some pharmaceutical companies have been quite upfront about wanting to help.
You know, they're trying to strike profit and they're trying to make it affordable, so it's always hard. You know, we all know that if it was generic, it would be cheaper for everyone, so we're kind of trying to find a middle on that.
All right, so I'm here with South Africa, and she's going to tell us everything that we need to know about her resolutions and her plans.
So essentially the resolution is focused on increasing education for healthcare workers such that healthcare workers can then provide a good treatment and prevention and screening of NCDs to their patients. This includes both the usual healthcare professionals such as physicians and nurses, but we're also targeting local traditional health workers that would be able to provide information about risk factors. So all of our initiatives are supported by NGOs and even some pharmaceuticals like Novartis, but we're really interested in working with other countries, especially countries in Europe that might have some funding towards these initiatives.
Did you contact America at all, or are you just looking at Europe for help?
Americas would definitely be amazing as well. And to be fair, like there are a lot of countries that I think share a lot of the same concerns as we do about education of healthcare workers. New Zealand, for example, has offered to maybe help. So any country that would be able and willing to help, you know, increase education, increase even numbers of healthcare workers in some of our countries.
So I spoke to Antigua during an unmoderated court case, and I found out that she had a blank sheet in terms of like the information that I have for my country. There was absolutely no information on who's suffering from NCDs, the rates of NCDs in her country, what's really going on with this disease that's actually killing people.
Right.
So I feel like for countries like the United States and Canada, who are way more developed, to suggest us supporting their healthcare systems or support their working papers is kind of not effective for countries who don't even know what's going on. So the reason why I suggested a skill was because I know that there's an economic disparity between large and very developed countries and small countries who are trying to they don't even have a voice. So a skill can allow countries like United States to work with countries like Costa Rica and Antigua and Dominica and small countries. So what the skill does is that it allows people to, who don't have information, to start there. So let's start with finding information, finding out what's going on, finding out why, like who's suffering from this from NCDs before we start implementing measures of like I guess like primary care and all that stuff, because if they don't even know what's happening, they don't know where to start.
Canada would actually like to emphasize that the Public Health Agency of Canada does have as one of our goals an imperative focus on sharing our knowledge and our expertise, particularly in the aspect of collection of resources and monitoring our mandates in order to develop and implement interventions in order to address our non-communicable diseases. And so we would like to point other countries to our very accessible portals, such as the Canadian Best Practices Portal, which will provide information on the research that we have done so far, or the Health Promotion and Chronic Diseases Prevention in Canada Journal, which will give you access to information on the kinds of research and practices that we have implemented in our country and help you develop your own.
Over the course of this weekend, Latvia, alongside several other countries, has attempted to propose an incredibly broad, overtly ambitious, and frankly unrealistic position paper, citing goals and targets such as reducing obesity, improving nutrition, education, something about loans, tobacco and alcohol use, as well as depression in minors. While these are all noble causes, how can one group possibly cover all of that ground? We were not granted an interview. So that begs the question, what is Latvia trying to hide? Is there something behind all of this flash and bang? Sources have suggested that this just attempts to solve far too many problems to be sincere or realistic. After several requests for comment about this particular paper, our requests were met with radio silence. Time will tell whether the plenary will be able to see through this flash and bang of a proposal and get to the real nitty-gritty of what is possible and what can be done. We're about action and answers, not hope and promises. While these are noble causes, the proof is in the pudding. Are you going to be able to do this, and by what means? We have questions, Latvia. You have answers. You just don't want to give them.
Powerful, moving, cogent, poignant, and well thought out reports. You are all on your way to being real heroes of health. We here at MonWHO News are proud of you, all of you. With that, we leave you with the immortal words from the enigmatic Mike Tyson. Everybody you fight is not your enemy, and everybody that helps you is not your friend. Signing off from MonWHO News, this has been Johannes Finkelheimer. Not a has-been.